I will be presenting Mrs. Wells today, a 28-year-old African-American female. She has history of asthma. She presents today feeling well right now, but she experienced an asthma attack 2 days ago at her cousin's house after exposure to cats. Her asthma was triggered with shortness of breath with an 8 out of 10 severity and wheezing 6 out of 10 severity lasting about 5 minutes. She used her albuterol inhaler to decrease her symptoms, which decreased the symptoms, but they didn't completely resolve. She's had about 10 episodes of wheezing and shortness of breath since. Her breathing seems to be worse when she lays flat or with movement and is accompanied by a non-productive cough, and she's woken up about 2 times a night feeling short of breath. She does not have any current use of spirometry peak flow, and she does not record any of her attacks or have an at-home nebulizer or vaporizer. She's history of asthma since she was 2.5 years old. She denies smoking, tobacco, alcohol, or illicit drug use. However, she was a marijuana smoker for about 5 to 6 years, last use at age 21. She does not currently exercise, and she denies any environmental exposures or irritants. She appears on this exam alert and oriented, sitting upright on the exam table, able to maintain eye contact throughout the interview and exam. Her chest expansion is symmetrical with respirations, normal fremitus, symmetric bilaterally, chest resonance to percussion, no dullness noted, bilateral expiratory wheezes in posterior lower lobes, bilateral muffled words with notable expiratory wheezes in posterior lower lobes with no crackles. Her in-office spirometry is FVC 3.91 liters, FEV1, FVC ratio 80.56% with the SpO2 of 97%. My diagnosis using the GINA 2024 guidelines would be moderate persistent to severe asthma. Her FEV1 FVC ratio is greater than 80%, but not by much, and she's having her symptoms daily to throughout the day and more than 1 time a week. My plan for her would be to add daily control as well as the as-needed inhaler, so I'll be giving her the ICS LABA daily, like budesonide formoterol, as well as using it as an as-needed control, and then to follow up with me in 2 weeks. As well, I would like her to keep a notepad of any triggering symptoms over the next 2 weeks, and then we can see those events to avoid.